Let's move into root canals, go deeper in that. Starting with who needs a root canal, what kind of injury to the tooth leads to that, and then why you're against them.
That is a controversial topic always in conventional dentistry. And also, obviously, again, a black and white thing. A root canal is a fine art. A root canal is an acute pain treatment. That means you, as a patient, had massive pain because you had tooth decay that went into the nerve inside, like a deep tooth decay. Bacteria kind of like invaded your pulp, which is the inside of your tooth, and your immune system caused an inflammation, and the pain from your tooth is the most insane neuralgia-inducing migraine-ish pain because your teeth are an extension of your brain. You feel it in your brain. It's hell. So we have to get you out of pain. And funny enough, in Europe, or Germany where I'm from, I think it's complete of Europe, a root canal is standard of care pain treatment. It actually is covered by the insurance. I only found out lately, actually, because of my worldwide teachings, that is actually not covered by the insurance in America. And is actually super expensive. So that's the only time when you would need it from a acute pain point of view, but obviously you could also go with an extraction. I would go, instead of an extraction, I would always try to keep that tooth, actually, to be fair. Not necessarily do a full root canal treatment, including the later filling. But what we could do is phase one of root canal treatment is take out the pain, take out the live parts and put a medication in there and keep that shell as a temporary, because that tooth still conserves the whole anatomy. I just explained to you, if you take out a root, the bone collapses. So you don't want to yank out the teeth, but see that root canal as a long-term temporary. Because from a more biological, holistic point of view, you then have a dead organ in your body. And this is just not optimal. Does it work for biting? It does. It does work for biting for 80% of you guys out there for 20, for 30, 40 years. No doubt about it. Is this the most health conscious choice? I don't think so. I feel that that could be the trigger holding you back from superhuman health. For some people, it's tremendous. They just have not the resilience to do this. The immune system is constantly fighting it. Some people are more resilient. They kind of like compensate it, don't even feel it, don't have a problem with it. But again, I'm working with guests from the outer realm, chronic inflamed, chronic sick, extremely high performance athlete, high performers, entrepreneurs, people that need to be on the edge. They need a 10 out of 10. For these people, it is not good to have a constant chronic fight in your jawbone with bacteria, toxins, and whatever, while you want to sprint a marathon, or you're working 12 hours, or you have tons of other things to do. It's just holding you back from superhuman health or actually be detrimental. So it's, again, nuanced. It doesn't kill you. It is a chronic silent inflammation, but we all agree on chronic silent inflammation being the trigger number one for chronic disease. And that is the killer number one these days. It's the epidemic. It's not the pandemic. The epidemic is that we're getting chronically sick. We're getting more and more into that. And I think there are better solutions. That's basically it. And luckily, we're not in the area where holistic dentistry started, where we just yank out all the root canals and have no solution and leave you like without teeth. That is not good and not a smart, straightforward idea. We're in the area where we can take out this root canal, if it is a root canal, get very gently, put an implant, put a temporary on top. You don't even see it. It just needs about 3 months, like a cast. Yeah, the temporary is a cast to osseointegrate it while you're on a bone healing protocol. And then you come back with beautiful teeth, with a beautiful osseointegrated ceramic implant that loves the gum, and you just put on a crown, and it's a pain-free and swelling-free treatment. I mean, that is the next level. It's not even controversial to dentistry at all. Anything technical, that is just an upgrade in our technical skills. The real upgrade is changing our profession from that technician mindset to the overall health expert, where this dental implant just becomes a tool to optimize our guests' health. I don't even think about that ceramic implant anymore. I've done so many. For me, that's just a side. It's just in there. It's just in the planning of the architecture of the new health. Versus most dentists are, even if they graduate to biological, for them, it's just about the technique right now and placing that ceramic implant. They're not even at the level yet where they can think about all the other protocols. But that's what I said. That's the biodentistry global standard that we're working on right now. It's happening right now. The momentum is there. Oral health momentum is finally there anyways. Like Huberman finally talks about oral health, having colleagues in there. Obviously not as deep as we're doing it right now. It's more the superficial level, but at least last year he had an episode where he brought in, he just talked about oral health, like from a surface level, including it into the 7 pillars of oral health. I also saw Brian Johnson talking about oral health and about his regimen. I also saw Peter Tia and listened to Peter Tia about this. So obviously we can go nuance and go deeper and deeper, and I'm quite sure that I'm going to meet these guys and going to speak with them about the next levels too. But I love that I can see finally dentists coming out. There's so many realms like functional dentists in America, which is a functional dentist is basically a conventional dentist that thinks more functional, meaning they think about the fluoride in the toothpaste, they go more natural, they think about the nutrition maybe. But they're oftentimes, for example, pediatric dentists, they don't even know about the root canal issues or how to fix them. So we have a solution that we provide to change the complete profession. That's just going a little bit more deeper and deeper and deeper. So I think the oral health topic just starts to come into this system. And I'm very happy about it because I'm kind of like trailblazing it for quite some time here from overseas in Germany. And I'm very happy to see that. But yeah.
If you enjoyed that clip, you're going to want to head over here and catch a full episode. I'll see you over there.
Everyone can call themselves a biological dentist. There is no trademark, no standard, nothing at all. We are changing the whole profession from us being a technician into a complete health expert for the whole time that you are wearing these fillings.